what you're doing is you're bringing that synovial fluid into your joint because you're getting that healthy, safe, non-painful motion.
Having an unstable SI joint issue or a popping, clicking hip? Find out what we do next.
All right, everyone, this is how we're gonna set this up. We're gonna basically keep yourself on your back, whatever is your target hip. Let's just say this is my right one. You're gonna bend it, and in this, what we call the hook lying position, you wanna keep your back flat. Now, the main thing to think about, if I'm just taking a quick view and slicing my knee in half, is that I move very slowly out, maybe 1 centimeter. Doesn't seem like much, but it's all about, like I said, that control. So we want to be out a little bit and then in a little bit. They should be even. You don't want to be out 1 centimeter and then all of a sudden go 2 centimeters to another side. So you want 1 and 1. You start that, see if you feel like that control. It doesn't seem like much, but it's really that brain to body awareness. Like I said, it's beware or beware is what I like to say, right? So, and then what we're trying to do is just add a little bit of grease. So think of it like when you're trying to, you got that pizza, pizza dough, and you want to kind of smear that tomato sauce and the pizza sauce all over nice and even. So that's basically what we're thinking about. Just a little bit here, kind of like a metronome, just a little, tick, tock, tick, tock. Now, as you get, if you feel like it's kind of shaking, now what's going to happen is going to be, it feels like you have no control. It's like, it's going to start rattling. I'm exaggerating, of course, but it's going to be rattling. That's not what we want. So you want, if it's like that, you want to keep working at it until it smooths out. So it's like that tick, tock, but so smooth is what we're looking for, very smooth. Now, as you get better from 1 centimeter, you can move to 1 inch. So then we'll go to 1 inch, 1 inch. And it's good to kind of just cue in and look at yourself. Is it looking correct? My whole foot on the same side is also just planted. I'm not really triggering any muscles in my feet. It's just kind of like a kickstand. So it's just there and there, there and there. And then what we're looking for is to get wider and wider. So let's just exaggerate. Let's go to like the 2 inches in, 2 inches out. I should have complete control of this, complete control. And if it's, like I said, ratcheting or kind of like skipping a beat and going on and off, we don't want that at all. So you got to keep hammering it out or smoothing it out. So then you get really good. You don't want your back to come off, like I said, but you go to the point your back's about to come off, then you can really control that. Now, a lot of people with aches and pains in their hips, they don't have the ability to control it at all. So we're just going, you want that smoothness, be able to take it through the range and not have it skip, skip, skip. So like I said, I'm repeating myself like a broken record for that very reason. We just want that nice, smooth rhythm, smooth pace. What you're doing is you're bringing that synovial fluid into your joint because you're getting that healthy, safe, non-painful motion. Like I always say, motion is lotion. That's what we're doing. We're trying to bring motion back in and grease up that joint and really help that out. Give it some of that stability. Now, this is also going to be great for those who've got that SI pain that I've talked about, is that we're just bringing that stability and awareness back into the hip, and it takes that pressure off of the SI joint. So we want the pressure to go here. And then we're just gonna go there and then, switch to the other side. It's worth doing both sides so you can see the contrast as well. So I'm just gonna do this side really quickly, but you should have control. You should be able to know what it looks like in space. What I'm feeling and what it looks like should actually match up. So that's basically the exercise.
So why does this exercise work? Number one, when I train my staff, I always say, be aware or beware. And the reason is, if you aren't aware of where your hip is in space and what it is doing, how are you going to assume it will be there when you need it for some of the most critical movements? Number two, slow and steady wins the race. Anyone can exert quick power, but being able to control the small movements is much harder. And the third, I'm a firm believer that the hip intrinsic muscles is going to be a physical therapy cure-all for healing, pain management, and sports enhancement. Mark my words, hip intrinsics and working those deep stabilizing muscles is so vital for so many different aches and pains. Let us know your thoughts on our video. Leave us some love or questions in the comments box below. Please like and subscribe. We appreciate your support. I'm Dr. Lin. Remember, we heal smarter, not harder.